So they have been, these three lead hospitals, three lead doctors have been very valuable to us. And I talk with them very, very frequently. I'm grateful to all three of the zone leaders who are with us today. First is Dr. Robert Wiley from the Cleveland Clinic, who is the lead for the northern part of the state. Dr. Andy Thomas from Wexner Medical Center leads the central and southeast Ohio zones. And then we have Dr. Richard Lofgren of the University of Cincinnati Health, who leads the southwest Ohio zone. In addition, with us today, we have Rhonda Lehman, president of Mercy Health, as well as Dr. Bruce Vanderhoff, our incoming chief medical officer at the Ohio Department of Health. Over this weekend, we spent considerable time not only talking with them, but also talking with other more rural hospitals throughout the state. And I came to the conclusion that it really would be good for what they have been talking to me and telling me this weekend, if they could speak directly to the people of Ohio, speak directly to our news media in Ohio and explain what they are seeing and where they think we are at this point. I am going to, unfortunately, have to jump off. I wanted to introduce them, kind of set the stage. I have a speech right now that was supposed to start a few minutes ago with the Ohio Municipal League, so I'm going to switch over to that. But let me turn the floor over first to Dr. Vanderhoff, and then we'll go through the other doctors who can outline, what they are seeing in their respective part of the state. So to all the doctors, thank you very much for joining us. Dr. Vanderhoff.
Thank you, Governor DeWine. Well, we are seeing in the state an unprecedented spike in hospital utilization, and it is impacting all areas of the state. Our previous waves during the spring and summer months were much smaller, and we were able to avoid overwhelming our hospitals by pulling together to reduce spread. The capacity challenges facing our hospitals during the spring and summer were different, though, than they are today. We were primarily concerned with the availability of limited global supplies of personal protective equipment, coupled with high demand for critical care and ventilator beds. To address those concerns, the state established the structure that the governor reviewed with us, and it really has allowed some of our larger health systems to help coordinate and work with our rural and community hospitals to balance surges that we have been seeing over the course of the pandemic. Today, we are better prepared with the personal protective equipment resources and physical capacity. However, what we are seeing now as cases surge is an increasing demand on our staffing. Every county in the state is feeling the brunt of rising COVID-19 hospitalizations, and those hospitals are staffed by nurses, physicians, and other healthcare professionals who live in those communities. As COVID-19 transmission rates rise in our communities, that depletes our staff as more and more of them are pulled from the bedside by community exposure. I'll turn to our panelists in a moment, but I want to emphasize that if we don't see a shift in the way things are going, meaning if we don't control the spread of the virus and our case numbers, we won't be able to continue caring for the acutely ill without postponing important but less urgent care. And we anticipate that this kind of shift could happen quickly in a matter of weeks if trends don't change. So now I'm going to turn to my colleagues, and I'd like to begin with Dr. Wiley, the Chief Medical Operations Officer from the Cleveland Clinic and the lead for Zone 1. Dr. Wiley. Well,
thanks, Bruce.
Okay, there you are. Okay, great.
It's a pleasure to represent Zone 1 in the Cleveland Clinic. Within the state, we have about 2,200 hospitalized patients, and over 50%, over 1,100 are in zone 1. And within that, we have over 300 hospitalized patients at the Cleveland Clinic hospitals. And what we're noticing is that we have adequate beds despite these numbers. So as Dr. Vanderhoff said, we have beds, we have enough PPE supplies, we have enough drugs like remdesivir, and we have enough ventilators. So if we look at the numbers, we're using about 10% of the hospital beds for COVID patients. And total number of beds being utilized right now is between 70 and 75%. In the intensive care unit, we're using about 13 or 14% of the beds. And with, again, total ICU use of about 70 to 75%. But what we're seeing is we're getting a lot of our caregivers who are coming down with COVID. We have over 300 out at the Cleveland Clinic alone today. And we learned about similar numbers on our zone call today, talking about every hospital in the northern zone, in zone 1. So everybody's having staffing challenges. And it's not because they're catching COVID in the hospital. What we're seeing is they're catching it in the community. So what we're asking everybody to do is to really double down, because the end looks like it's in sight. Pfizer reported in the last day or two that their vaccine trial is over 90% effective. We were hoping for a vaccine that was 70 to 75% effective, and it looks like we're going to do a lot better than that. So now is the time to wear a mask and socially distance, if not to protect your family and your friends and your community, then help protect the caregivers, which not only have to take care of COVID patients, we need them in place, but for all the other things that people come in the hospital for. So with that, Bruce, I'll turn it back to you.
Thank you so much, Bob. Next, I'd like to introduce Dr. Andy Thomas, who's the lead for Zone 2 and is the Chief Clinical Officer at The Ohio State University. Andy?
Thank you, Bruce. Just to echo a little bit of the experience that Bob is having up in Zone 1. Here in Zone 2, we do routine calls now Monday, Wednesday, Friday at 9 a.m. with our regional hospital partners. We do a variety of touch bases throughout the week to make sure that we're understanding the capacity challenges and needs of the hospitals in the zone. One of the parts that's changed a fair bit compared to the spring surge or even the summer surge here in Franklin County, whether that was Ohio Health, Mount Carmel, or Ohio State. Now that number is down closer to between 50 and 60% each day. It's a really good sign that our regional hospitals and smaller community hospitals have actually built the capability of managing those less sick COVID patients, and even frankly, some very sick COVID patients within their facility, within their med-surg and ICU units. That's been an incredible benefit to all of us, and that we've been able to make sure that they have the resources they need, the medications they need, any assistance that they need to But by then it's too late. They've already been in that crowd without a mask on, not distancing, and potentially infecting others. So I think, here in Zone 2, last Monday, we crossed 400 patients in the hospital for the first time. By Friday, we crossed 500 patients in the hospital for the first time. And today we're over 560 in the hospital. Even for the state, the numbers that Bob was quoting, we crossed 2,000 patients in the hospital for the first time last Thursday. Today, we're over 2,500. So this is a serious problem. It's rapidly changing. A week ago or 2 weeks ago, if I would have talked to you, I would not have had the same sense of anxiety that I have today. Now, this doesn't mean tomorrow we're going to stop doing elective surgeries all across the state. We're trying to do everything we can to avoid that. However, we do need to make sure people are aware of how serious this is. So,
Andy,
Bruce, I'll send it back to you.
You briefly cut out when you were talking about what was different about the surge. In a sentence or two, could you tell people what you were pointing toward?
Certainly. So just like cases are distributed differently across the state than back in the spring, our hospitalizations are distributed differently. With smaller, more community-based hospitals are having patients staying closer to home for their COVID care. And that's actually been a really beneficial thing, reserving the capacity at some of the larger referral hospitals for the sickest of the sick that need to be in the hospital.
Thank you very much, Andy.
Thanks.
Appreciate it. And now I'd like to introduce the lead for Zone 3, Dr. Rick Lofgren from UC Health down in Cincinnati.
Thank you, Bruce. Hope everybody can hear me, and I appreciate it. And I'm going to echo a story that you've heard from my two other colleagues in the other zones, and that Zone 3 has had an unprecedented increase in the number of hospital cases since really the beginning of October. And we in the Zone 3 have over 670 patients hospitalized today. Our previous peak prior to this third surge was 300 patients in July. So this is a whole magnitude higher. And I might also add, we were doing quite well as a community up through September, but really since the beginning part of October, we've seen this marked uptick. I might add that just this today, we were looking at more specific and detailed information as it relates to Region 6 in the greater Cincinnati area. Prior to the beginning part of October, our positivity rate was in the low 3s. Now it's hovering around 8%. And the growth of hospitalizations in our community is growing exponentially and predictably exponentially. The number of hospital cases in our community is doubling every 3 weeks. Right now we can accommodate the 360 some patients that are in our community right now. But the impact on hospitals is highly sensitive to the rate in the spread of the virus in our community. If the doubling time continues at a pace that it is, that we've seen since the beginning of October, every 3 weeks, by Thanksgiving, we'll have 690 patients and over 170 patients in the ICUs in our region alone. That represents about 30% of our capacity in the region. If you start to model it, which we've started to do, if you in fact increase the doubling time so that it was actually then 6 weeks instead of 3 weeks, we'd only see about 300 patients in our facilities, a number that we can certainly accommodate within our existing capacity. Unfortunate, but something we can manage. On the other hand, if we really continue to accelerate it, and in fact, the doubling time went from 21 days to 14 days, we would see over 1,500 patients in the region during that time period. It is at that point that you start to exhaust the resources that my colleagues have mentioned, and most notably staff in terms of that. And it would result in us needing to think about deferring non-COVID care, which we recognize really has had and would have adverse effect. The other thing that I would just highlight is that it emphasizes that what we've done in the past, what we did in the early part of fall, of adhering to those basic simple principles of social distancing, wearing a mask, washing your hands, and not expanding your personal bubble. And if you do, that you maintain those social practices of masking, we can bring the spread of this virus under control that's quite manageable. But as we sit today, since the beginning part of October, we are seeing an exponential growth, a growth in hospital cases that's doubling every 21 days.
Thank you so much, Rick. Very, very helpful. I'd like to turn now to our colleague, Dr. Rhonda Lehman, who is the president of Mercy Health up in the Lima area. Rhonda?
Thank you so much, Doctor. Yes, my name is Rhonda Lehman, and I'm the president of Mercy Health St. Rita's here in Lima, Ohio, part of Bon Secours Mercy Health, and I'm a lifelong resident of Allen County, here where we're located. St. Rita's is a major regional referral center for the 8 counties surrounding us, including Allen, Putnam, and Auglaize counties, several of which, as you've seen on the data recently, are experiencing incredibly large instances of COVID positive rates right now. We're a level 2 trauma center. Our average daily census is usually over 200 or so, and we've really prided ourselves on being able to take patients in from the surrounding counties and be a referral area for them to lean on. In addition to being a hospital president, my husband and I have 3 children, 2 high schoolers and 1 middle schooler, and you can't imagine how much we would love to get back to life as normal, even the hectic, crazy normal that we had. Our experience at St. Rita's has not been unlike what many of the folks before me have described. In the spring and summer, we prepared and we planned and we watched the news, and we were all pretty concerned about what things could look like in our community. And we felt pretty good going into it, not to minimize the 10 or 15 COVID inpatients we had, but we felt like we could manage. Got through the summer, and we're feeling like we'd have to just kind of see what the fall held, and also continued to be prepared. Well, unfortunately, as you've heard from my colleagues, while our PPE supplies are in good shape, our testing is decent, and we do have enough ventilators, and truly beds are not an issue. We talk a lot about bed capacity, and we think about tents being erected and people taking up, civic centers and different places to see patients, and that's not the situation we're in. I think because of that, maybe it's a little bit invisible to people walking around in the community about what's happening inside the walls of their hospital, their local hospital. We're really appreciative that some of our regional partners have been able to take more patients. As they alluded to, some of those smaller communities have been able to up their capacity, and that's helped. On October 5th, we had 17 COVID patients, and we were like, all right, we've got this. Today we're at 75. And that is a stark challenge for us, because that's in addition to the, I'll say, normal fall, flu, and other types of critical illness volume that we see, and it's not sustainable. Our biggest challenge isn't patients that are in nursing homes. It's not patients that are in prison settings. And with all due respect, it's not from Cincinnati, Cleveland, Columbus. This is not a metro problem. This is a statewide and a countrywide problem. And I want people in the communities, the small communities throughout Ohio, to recognize that those behaviors in those smaller burgs do roll up and have a substantial impact to their neighbors, their local hospitals, the people they worship with, the people they go to school with, the people they care about in their circles. Our challenge also is people, having enough staff, having enough critically care trained nursing staff. We've really pulled out all the stops. We've looked at our various physician office practices. We've looked at redeploying people into different roles. People are stepping up in incredible ways, and they're really tired, and it's still November. So we're concerned as we look down the pike, as we look about what could be ahead of us. And we truly want everyone to understand that and to start making some of those changes that can make a difference. Everybody that knows me would tell you I'm an extreme optimist. And I'm an optimist about this as well. I'm an optimist about the vaccine, but I also would say I'm even a more optimist about what each of us can do individually if we make some critical behavior changes. And I already told you, I want to get back to life as usual too. The last thing I want to do is give up Thanksgiving and Christmas and the things that are coming we're looking forward to. But we've got to do it differently. We have to. Truly, the survival of our communities is depending on you. And when you talk about our healthcare heroes this spring, what a great feel-good message, right? Everyone's, oh, yay, healthcare. And we love that. And we appreciate that. But the strongest gesture that anyone can make right now isn't with their words or with acknowledging people. It's with their behaviors. So I'm imploring you to dial it back. scale it back, gather less. I know that we're excited. I know we want to be out there. I know we want our small businesses to continue to run and be successful. It's not an either or, in my humble opinion. We can get there. We can all survive this if we all just choose to make some better behaviors that we've been reinforcing over and over and over again. It's just about saying no to some of those gatherings a few more times and being able to be an example to people in your community as well. So I appreciate very much the opportunity to just kind of tell our perspective a little bit here in Lima about what's been happening. I'd be remiss if I didn't take an opportunity on the floor to say thank you, thank you, thank you to my colleagues, the nurses, the physicians, the phlebotomists, the pharmacists, everyone who is doing everything it takes to help our patients, both in Ohio and across the country and here at St. Rita's. But thank you very, very much for all that you're doing. I'll turn it back over to Dr. Vanderhoff.
Thank you so much, Rhonda. So let me sum it up. We're grappling with unprecedented COVID-19 numbers, and they're impacting every community. Not surprisingly, our hospitals statewide are approaching maximal capacity, not because of limitations of safety supplies or physical beds, but because we're exhausting the available supply of trained personnel. Our nurses, physicians, pharmacists, other healthcare providers live in our communities, and they can't escape the impact of rising COVID-19 numbers in their communities. When they have to quarantine, they can't be at the bedside. We need your help with masking, distancing, and hand hygiene. Masks work. They protect us personally, and they can help decrease the spread of COVID-19. So with that, I think we're ready for questions that may be on the floor.
Doctor, first question today is from Farnoosh Amiri at the Associated Press.
Yes.
Hi, doctors. Thank you for taking the time today. I'm wondering if any of the current relationships that hospitals are having with the Trump administration is going to change now that there is a new president-elect.
All right, good question. I'm going to turn, Andy, would you want to field that for the group?
Well, I think much like state government changes over time, and administrations change, so we're quite used to the federal government having administrations that change. So no, I don't see any substantial changes, except for the fact it sounds as if President-elect Biden has announced a new task force and some new focus around trying to standardize the approach to this a little bit more across the United States. But obviously, we're focused on what's going on here in our local community, in our region, in our zone. And we're quite used to dealing with changes in administrations and policy changes coming out of Washington. So we'll obviously, if asked our opinion, we will share that. But I don't think that there's any difference that would be there from one administration to the next from our perspective.
Next question is from Jackie Borchard at the Cincinnati Enquirer.
Thank you all for your time today. The experts have said all along that the key to stopping the spread is testing and contact tracing. We're much, much higher than we were in the summer during the last wave, and hearing reports that many maybe aren't cooperating with the contact tracing portion. Are we at a point where it's too late to control the spread?
Very good question. Thank you. Rick, would you want to field that question?
Great question. And I think there are a couple things. One is that at this point, we are starting to overwhelm our ability for contact tracing to follow up just because the sheer volume. So that you're starting to see some of the health departments triaging the more important cases. They have experienced some resistance in terms of contact tracing, which I do think ultimately does interfere with our ability to identify, isolate, and contain the infection moving forward. But I'd also like to highlight that what we've learned through the contact tracing, unlike earlier in the pandemic, where we were seeing spikes in nursing homes or spikes in congregate living, what we're getting back is that we're seeing this spread happening in large part because individuals are dropping their guard. that they're in their own social gatherings, in their own day-to-day life. They've sort of relaxed in terms of maintaining social distancing and masking and allowing more people into social events that are not part of their bubble. And that's where I think we're seeing the wide and diffuse spread of this virus across the region. So identifying cases, isolating them, following the contact tracing is important. But I think one of the things we want to make sure that everybody hears loud and clear, we have done this in the past. As recently as you look at the data in August and September, we as a community were doing quite well. We've let our guard down, and it doesn't take much for this virus to start to spread exponentially again. And so I think it's that whole piece that we really are looking for everybody in the community to step up and do their part.
Next question is from Kevin Landers at WBNS in Columbus.
Hello, my question is for all of the doctors. Early on, when we had far fewer cases, we had a stay-at-home order in place, and we were able to push the curve down. Now that we have huge amounts of number of cases, do you believe a stay-at-home order will still be effective in reducing the stress on hospitals? And for Dr. Andy, what is that oh my God moment for Central Ohio where you look at the numbers and say, we're going to need to start stopping elective surgeries or move people to outside hospitals to make room for patients here in Central Ohio?
Andy?
Thanks for the question, Kevin. So I'll take the second half of that first. I think, and Bruce in his role at Ohio Health is well aware of this. We talk amongst ourselves multiple times per week, and all of us here in the Central Ohio hospitals have plans where we can escalate our surge capacity inside the facilities. At some point down the road, you run into a situation where in order to staff those additional beds, you need to pull those staff from somewhere. They may be doing a certain type of procedure, or they may be helping a certain type of patient recover from a procedure. And that's the point where I think each of us as individual hospitals would make that decision in a different way. As it was referenced earlier, PPE was the big concern back in the spring that led all hospitals across the state to stop doing elective non-urgent procedures. It is very different now. So we would take a step-by-step approach, making sure that we're growing our capacity as it's needed, and then slowly move into potentially less urgent procedures that we might be able to postpone, screening procedures or similar things that would certainly be nothing like threatening or limb threatening, any of those things. So I don't know that it's going to be a snap of the fingers, Kevin, and we're going to announce we're stopping doing things. I think it would be more slow over time, and each hospital system will make those determinations based on their capacity and their staffing. And what was the first part of your question again, Kevin?
Early on, we had a stay-at-home order, and do you think now, because we have larger cases, do you think that would be effective in reducing the spread?
Well, thanks for the question. I'm not sure that it would, only because I think when I go out to Giant Eagle or when I go out to Home Depot, not to use brand names, but to stores, I see a lot of people in masks. That's terrific. I think what I'm hearing from our public health colleagues and what I'm hearing from our physicians around the state is a lot of the spread of this is happening in people's personal homes. It's happening with parties in people's backyards or in people's basements. It's happening at large weddings, unfortunately happening at funerals. I think we've all heard those anecdotal stories. So I think a stay-at-home order that would, for some reason, close all businesses or manufacturing, in my mind, doesn't seem to make sense this time around, because I think it's really much more about personal behavior and activities in your personal life. In fact, I've been on calls with school district leadership from different parts of the state where they'll say, parents will, when they come to their child's game, will wear a mask when they're in the stands. They leave and go to someone's house for a pizza party afterwards, and no one's wearing a mask when they're at this person's house. The same people that wore a mask the whole game because they want to come see their child's game. So it really comes down to our personal behavior and our personal life. And that's very hard to legislate or regulate from a state perspective. I don't know, Rhonda, do you have thoughts on that?
I agree wholeheartedly. I think that that's exactly what it comes down to, that we need to, that legislating that probably isn't the answer. We're not seeing widespread of the virus in places like shopping stores or the schools, that we really need to look at our own kind of personal behaviors to quell that.
Next question is from Josh Rutenberg at Spectrum News.
Good afternoon to all of you. You just got done saying that you don't think that a stay-at-home order is the right thing to do and that it shouldn't be legislated and that basically personal responsibility is what needs to happen, but we are not seeing personal responsibility statewide, and it's happening at an alarming rate. So what is the answer if people are not following these simple guidelines to an adequate standard of wearing masks and social distancing and avoiding large gatherings, because it's clearly not happening? So what would you all say as opposed to just doing the same thing over and over again and expecting different results?
Well, let me give my colleague, Dr. Wiley, a chance to take the first stab at that.
Thanks for the question. I think that's one of the reasons we're here today as the zone leads, talking to everybody, is to try to say that now is not the time to give up. Now is the time to double down on what we've been doing, particularly since we have an endpoint in sight. If we have a vaccine, and we'll have to look at all the safety data and everything else, but if we have a vaccine that's 90% effective, within the next 4 to 6 months, the population is probably going to be vaccinated, and we won't be having the same discussion in 6 months. What we don't want is to overwhelm the system or have people get COVID or get hospitalized or even pass away when we're just in sight of the end and the vaccine coming out. So that's what we're trying to encourage everybody to reevaluate, to relook. That's what we've all been saying in terms of the answers to these questions is we need to monitor our personal behavior. We need to reconsider it, not only for our family, friends, but also for the healthcare workers who are trying to stay in the hospitals and provide care for not only COVID, but everything else that we've talked about. So cardiac disease, neurologic disease, everything else that people come to the hospital for.
Next question is from Joe Ingles at Ohio Public Radio and Television.
Hello, thank you for having this today. I am hearing from some smaller hospitals that this problem is really getting out of control for them as far as space is concerned. Some of them are talking about reappropriating space that they have because there's a fear that they're running out of rooms. For instance, maybe using a cafeteria and turning that into space for beds. I guess this is more like Rhonda's question, but are you hearing that from your hospitals? I know you're hearing the staff problem, they don't have enough staff, but what about the facilities? Are there enough facilities to handle this?
Well, let's turn that to Rhonda.
Thank you. I would say that what we are hearing from the various hospitals and the counties surrounding us is that because we have had the foresight of being able to prepare for this, they have been able to take some existing space and convert it into negative pressure. So they are able to keep more of those patients. I haven't heard of the cases like you're describing where they are having to put them in, I'll say, non-traditional spaces to house patients, but I have heard a lot of people that have been converting spaces just as we have along these previous months to make more spaces appropriate for COVID patients so that having the negative pressure. And big shout out to our facilities people who have been doing incredible work all hours to make sure those spaces are ready for patients with all the monitoring and pressures that we need.
Next question is from Spencer Hickey at Hannah News Service.
Thank you. You've talked about the possibility of having to pause elective procedures in certain hospitals as cases rise in those communities. Could you talk about what that could mean for children's health and children's hospitals, given that they've raised concerns about how important that is in light of their pause from the spring?
Dr. Wiley, would you want to field that?
Sure. I think the children's hospitals, fortunately, have had a little less burden than the adult hospitals have. My background is in pediatrics, and so I'm pretty familiar with the children's issues. There's a multi-system inflammatory condition which occurs, which can be devastating, but fortunately, that's relatively rare. And children require significantly less frequent hospitalization. I will say, relative to the previous question, Bruce, that one of the reasons we formed the zones was to make sure that we could load balance across the systems. So in the northern zone, I know in zone 2 and zone 3, we take patients away from hospitals which are suffering from significant challenges, and we start to transport them to larger urban centers where we have more capacity. And we've done that successfully ever since the pandemic started, and we plan on continuing to do that.
Next question is from Alex Ebert at Bloomberg.
Thanks for your time. Drs. Lehman and Dr. Wiley, these questions are for you. You represent simultaneously one of the nation's largest healthcare networks and one of the nation's most prestigious. Can you talk a little bit about how this is impacting your ability to provide care to the abundant patients that you have in your groups, as well as push the envelope of medical research? What sort of things are we losing this year as we clear space to make the care available for COVID patients? Thank you.
I can take the first crack at that in terms of the Cleveland Clinic. So I think this has been a tremendous research opportunity. The clinic has published over 400 research articles on COVID and viral diseases. We have several significant additions to the Cleveland Clinic staff in terms of investigating viral illness, which I think will benefit the Cleveland Clinic as well as the state of Ohio moving into the future. So I think that's been a significant opportunity. When we quit doing elective procedures, we saw a decreased number of heart attacks and strokes coming into the emergency departments, but we know that we're still having those, and they were coming in relatively late. So we saw people come late into the illness when we had less therapeutic options to treat their emergency conditions because they had the emergency 2 or 3 weeks before actually coming into the hospital. So fortunately, we see that reversing now. We're going to continue to load balance and monitor very carefully the care that we give, and hopefully people will again double down and look into the future and see that there's an end in sight, and then start to do the things that we've talked about.
Thank you. Rhonda?
Yeah, so I would look at this again. I think that the opportunity is ripe for lots of education and research, and I really think that people are getting a different experience in those areas, not lacking it. I think this is an incredible opportunity as part of a large health system, Bon Secours Mercy Health, for us to be able to show our mission in action to all of the communities that we serve. We actually opened here in Lima a little over 100 years ago during a pandemic, and here we are again in a pandemic doing exactly what we're called to do. So again, I think that it's important for people to hear and understand that we are here to care for them, all of us are, but that we want to be able to do that in a safe and reasonable manner. And so I think that that's really the positive side of this for being part of a large health system for us.
Next question is from Laura Hancock at cleveland.com.
Good afternoon. Thank you for taking the time. I am just wondering, we have some evidence that Canadian Thanksgiving ended up being a situation where a lot of families spread coronavirus to each other. And I'm just wondering why at this point you guys are not calling for maybe families to rethink Thanksgiving from the traditional way it's normally done, maybe do it through, Zoom or whatever.
Having just done a Zoom birthday party for my son with our family yesterday, he didn't get to see his 7 cousins. He didn't see any of his grandparents on his birthday. Trust me, I think a lot of people are making those tough choices. I think that moving forward with Thanksgiving and then the December holiday season, it's going to have to be a priority for people to realize that there are other ways to be with loved ones and be in their life than all being in a room together for hours and hours and hours of time, as much as we've done that for years and generations. It's going to have to be the tough choice that people make to get to that end point as we've been describing, where there is a vaccine that's abundantly available later in 2021 that will be part of our pathway past this pandemic. It's going to have to be a must, or else what feels like a very, very busy flu season right now, that's usually in mid-January. Right now, it feels like that in early November. I can't imagine what January is going to look like if people are not willing to make those tough choices and those sacrifices in a very meaningful way.
Yeah, and I would add that I really do believe that we have been messaging this very important point. But unfortunately, with so much else going on, many times the messages in healthcare have not really gotten the attention they need. I think you can rest assured you will hear increasing messaging in the days that come, encouraging people to think differently about their holiday gatherings, and there are other group gatherings.
Next question is from Scott Knoll at WEWS in Cleveland.
as the number of cases have risen dramatically over the last few days, we've been getting a lot of questions about enforcement of things like mass gathering orders and mask mandates. Are there any plans at this point to ask cities and counties to increase the enforcement of these things to help slow this spread down now?
Well, let me field that. It is very clear that we all need to do more as it relates to masking. I think that begins with us sharing the message. And what we're really calling for here is help getting the message out. We really believe that most Ohioans understand the importance of social distancing and masking. We think a lot of what's happened is we've let our guard down. So we'd like to begin with this message, the message that this is really important. And we know from the scientific literature that it makes a difference. We know from our experience that it makes a difference. And so we're asking for everyone's help. And I think that's where we want to begin.
Magically safe from the spread. And so I think that that's the mindset that we have to get people to recognize. Yes, we can clamp down on some mass gatherings, and the spread isn't happening in the schools and the businesses and the bars like it was initially. It's happening in the everyday life. And I think that the question about how does Thanksgiving look different, it's either you don't have it or you don't break bread, because sitting across the table is a very dangerous, but also the idea that you bring people into your home, they're going to wear a mask. They're indoor, not any different than a restaurant. And so I think that we all recognize that we know a lot more than we did 7 months ago. We know what works. We as a community have already demonstrated that we can live into that and keep the virus at bay. And I think that all of us have fatigue about this. Rhonda talked about her own family and how frustrating it is. And I think we all feel that, but we know what works and we know it keeps our safe, and it's remarkably simple.
Rick, one thing to clarify, I think, for what you said, because I don't disagree with you. I think the spread is not happening in bars and restaurants because the vast majority of bars and restaurants are taking this seriously, separating tables, putting in plexiglass, staff are wearing masks, patrons are wearing masks when they're up and around the bars and restaurants. Many of you from the media hear from Mashika Roberts, our local Columbus Health Commissioner. And what Dr. Roberts will share is she thinks 95% of the bars and restaurants are doing this right in terms of cutting off service late in the evening, earlier than usual, and making sure that their patrons are following the rules. So that's why bars and restaurants are working, is because most of them are following the rules. Without those rules, I think we would be in a much, much different situation and in really big trouble.
Next question is from Jake Zuckerman at the Ohio Capital Journal.
And thank you all for being here. I have a question for Dr. Vanderhoff. The surge we're seeing right now started in late September, and the messaging of wear masks and don't gather hasn't really changed and hasn't really worked thus far. We've had some of these kind of come together moments, and now is the time to turn it around, and they never seem to really move the needle. So when is it time to change the playbook, whether that's messaging or policy? And why does it feel like we're still repeating the same stuff?
Well, thank you. I appreciate the question. First, let me say that while we have shared the message about masking and distancing, we're human beings. And there is a very real phenomenon of COVID fatigue. It's been described. And part of what we are doing today is reminding people that there is hope, there is light at the end of the tunnel, but we are facing today the most significant surge to date, and that we need to close ranks and work together to ensure that that which we know works. There's just no question that masking and distancing work. Scientific literature is replete with evidence of that. And we're asking people to come together and do this. Now, your question is a very, very good one, and it is part of the dialogue that public health leaders and governmental leaders are having right now. Will we need to go further? And if so, what are the right steps to take? But this is the first step. We need to remind everyone of the importance of masking and distancing, and point out to them how significant this surge is. The other thing is that we can all reflect on the friends and family with whom we interact all the time. And I think when we do, we'd recognize that this COVID fatigue, this almost laissez-faire attitude towards COVID has kind of crept into our lives. So that's why we're starting with this today. It does not mean that we don't think that additional steps might be needed, but why today? Well, the today reason is because of the surge we're seeing and what we're observing.
Next question is from Danielle Grossman at WCMH in Columbus.
Thanks so much for talking with us. So my main question is, I've talked to a few different hospitals in rural areas in Central Ohio. I guess it's for Dr. Thomas. And a lot of them really expressed that they were concerned that they don't have a place, a centralized area to send a lot of these elderly or people who have COVID-19 but are not in ventilators. They're in that in-between mark where they just need a 2-week recovery period. And the issue is all of these nursing homes and facilities are full and they won't accept COVID-19 patients. So the 3 hospitals I talked to said that they wish they had another place or centralized location outside of the hospital to kind of help with the excess patients that are in recovery. Is there a plan in place for this? Do we have any advice for the hospitals, things like that?
Thanks for the question. So a number of months ago, I would say it was over the summer at some point, maybe even late May, the Ohio Department of Health laid out a process where a skilled nursing facility could become what's called an HCIC or Healthcare Isolation Center. We did not have many skilled facilities in the in Zone 2 that applied for that. We do have some now that have that standard and are willing to take other patients. So that is a relatively new phenomenon in the past month. We do 9 a.m. regional surge calls Monday through Friday. We'll make sure to emphasize that to some of our hospital partners here. But that is relatively new. That did not exist here in Zone 2 up until just a few weeks ago.
Okay, great. Thank you.
And in Zone 1, we have started to see some of the area skilled nursing facilities stepping up and making those areas available, those segregated spots. So we anticipate this week that we're going to be able to start transitioning some of those patients. For a while, we were able to maintain them here through our own transitional care unit, but outgrowing that capacity, those regional partners have really started to step up and help us.
Next question is from Jim Oddie at WHIO in Dayton.
Hi, this is a question for Rhonda Lehman and anybody else who would want to chime in. At this point, are you ready to, at a very minimum, ask the governor to start making some additional restrictions? Everybody keeps talking about weddings and funerals. Are we ready to make some changes in the allowable number of people who are permitted to attend weddings and funerals? If that is the problem, why are we not addressing the problem?
Well, I think in some ways we've addressed that question through some of the other ones previous to this about having authority to enact some of those things. I think that really that we are at the right spot, and as far as requesting that the public really engages with us and sees this as a problem that they can fix. I don't necessarily think that putting those numbers on those different events is going to be the answer, because short of going in people's basements, right, or going to the places that they're gathering after that, which is really what we're looking for that support from. So I don't necessarily think that that is our place today to go and look at limiting some of those different numbers. I think we are where we need to be right now, and that's requesting that our different communities be more responsible, whatever that looks like. We've given them those tools. As I said before, it's simple, it's not challenging, and it's something that we can all comply with.
I think to add to that, and Bruce, I think, was touching on this earlier, it really comes down to starting with why are we asking people to do that? That's what we're trying to do today. If you have a cousin, a brother, a niece, a neighbor, a friend from high school who is a nurse, a pharmacist, who works in environmental services at a hospital, who's a doctor, whatever it might be, if you aren't willing to do these things for yourself or your family and your loved ones, do it for them, because they are on the front lines serving the people of our community every day. That's the why we want to talk about here. It's not the what, it's not the how we're going to enforce it, it's the why. And hopefully we still live in a state where the why matters. I know it's mattered immensely here at Ohio State is we took what was going on with our students and really changed behaviors a number of weeks ago. The fact that we're still open today and we'll hopefully make it through to Thanksgiving break in a couple of weeks. But the why is what matters. And that's what we're here to talk about today. The why is the people who you went to school with, who you see at church, who plays soccer with your children, whose kids, go to school with your kids. That's the why we're talking about. And the why is also those people who need the routine care, the people that get in the car accident, the people who get cancer, the people who have a heart attack that need to have their gallbladder removed, whatever it is. If we don't have capacity for those people to be taken care of a month from now or 6 weeks from now, or God forbid, 2 weeks from now, that's a big problem. You might not be worried about your own health. That's your personal choice, but please worry about your neighbor. Worry about the person who goes to church with you. Worry about the person who checks you out at the grocery store. Please, that's the why.
If I could add, I think that one of the things that I would say, and it was asked about what's different now, I think we're also asking every leader at every level in the community to take responsibility, whether or not it's in a business leader, your own social work, wherever you are a leader, the message has to be clear. And my colleague really articulated nicely the why. If you want to keep the business community and our economy thriving, you will follow this. If you want to have some social contact, all be different, this is the why. If you want to keep schools open, this is the why. If you want to make sure that we don't have to defer non-COVID care because we're just busting at the seams kind of thing, this is the why. But we are calling upon every leader to really at every level to sit down and make sure that they're understanding about why these simple measures, and they are simple, really makes a huge difference in every aspect of our life.
I think considering this is your COVID year, you have to get through your COVID year. And again, next year, going into 2021, it will not be your COVID year. So this is time limited. This is your COVID year. We've got what looks like excellent vaccines on the horizon. So that's the framework we're trying to put this in.
Dr. Vanderhoff, it's getting close to 3 o'clock, so we have time for one more question, and that question belongs to Tom Bosco from WSYX in Columbus.
Tom?
There you go. Sorry, I needed to unmute. What do you say to those who point to previous predictions that have not come true? Basically, I'm talking about the people who are denying that it's as bad as it is, the people who are skeptical of the numbers, skeptical of the process. Do you point them to a specific number? Is it number of cases? Is it number of deaths? How do you convince those people that this is real and these are real numbers that should be paid attention to?
Well, thank you. That's a very good question, and it's one that we've given considerable thought to. I think the best statistic, the most reliable one, the one that I hope that the public has confidence in, is what we as physicians are telling them is happening in their hospitals. That every community's hospital is seeing unprecedented numbers of patients needing hospitalization for COVID-19. That's a figure that is about as reliable as I can imagine. Because when a sick patient comes to the hospital and is evaluated by a physician for admission, all that doctor's thinking about is this patient sick enough that they need to be here? And if not, they're going to send them home. The fact that they are making the decision, I need to admit this patient, and the patient happens to have COVID, tells us that the COVID illness in our community has hit a very serious level. We have unprecedented hospitalization numbers, and it's not in one community, it's in all of our communities. That's a figure that's hard to argue with.
All right, thank you for everybody for joining today's press conference. Have a good afternoon.
That was Governor Mike DeWine, joined by the Ohio Hospital Association members there, doctors leaving us on a note, just reminding everybody, as we continue to see more than 4,000 cases a day of COVID-19, we have unprecedented hospitalization levels in the state. And if numbers keep going up as they are right now, the doctors and the hospital association, they're saying we could be 2 to 3 weeks out from going back to restricting non-COVID procedures to keep our hospital levels down in case of an emergency, as far as ventilators and beds and different things like that, what we prepared for at the beginning of the pandemic as we see cases continue to rise. Let me pull up the Ohio Department of Health's website here, and we will go over today's COVID numbers. Here's the website right now that we're familiar with. Go to the dashboard, and the current trends page is what I generally use. Again, we had 4,700 new cases of COVID-19 today. As the 21-day average gets higher and higher over the weekend, Saturday, we saw the most cases we've ever had, 5,549 new cases. The 21-day average is now at 3,398, almost 3,400. Deaths reported within the past 24 hours are 7. That is well below the 21-day average, which is a good thing. Again, these hospitalization numbers continue to tick up. New hospitalizations reported within the past 24 hours, 154. 21-day average is 166. And those doctors from the hospital association saying that if these numbers continue to increase like they are, we could see 2 or 3 weeks from now having to go back to restricting non-COVID, non-emergency procedures. So something very serious. The governor coming on today on a non-scheduled, non-regular day. He normally does his press briefings on Tuesdays and Thursdays, but he wanted to bring those doctors from the hospital association on to really let people know what is going on in hospitals across the state. It's not a particular community where this is happening. It's not just urban. It's not just rural. These doctors say that it is widespread, and they want people to take this very seriously so we don't have to go back to restricting medical care to avoiding non-COVID and non-emergency situations. So all the information that you need is on our website, NBC4i.com. If you are watching there, you can scroll down and read more about that. And if you are watching on social media, Facebook, the link is in the description of this video. First at 4 begins in about an hour. We will have team coverage of what the governor had to say, as well as other COVID-related issues happening across the state and here in Central Ohio as well. We will see you then. Bye.